Washing hands, hygiene is performed. I see a 30-year-old well-developed female with no obvious respiratory or cardiac distress. Hi, my name is Claire. I'm one of the family nurse practitioner students from Texas State University.
Hi.
How are you today?
I'm very well. How are you?
Good. I'm going to be starting a head-to-toe physical assessment on you, if that's okay with you.
Yeah, absolutely.
Wonderful. While we're doing the assessment, I want to ensure that your privacy is maintained the entire time. So if you have any questions or you feel uncomfortable at all, please let me know and I'll try and alleviate that.
Absolutely.
Wonderful. I'm going to go ahead and start with your hands. All right. So as I see the hands, they are equal and symmetrical. They look normal. They have no obvious lesions, no signs of rash or redness. I'm going to check skin turgor here. And skin returns rapidly to normal, which is no indication of dehydration. As I move down the fingertips, I notice that they are pink in color, no cyanosis, no clubbing of the fingernails, and the nail beds are pink in color again. Cap refill is at 2+. As I flip the hands over, I notice they are warm and dry to touch, and again, no lesions, redness, or abnormalities are noted. As I work up the arm, I notice again there's no edema, no deformity, no bony prominences noted. I'm going to go ahead and start with your radial pulses. Radial pulses are 2+ bilaterally. My scale would be 0 to 4+. Going into the brachial pulses, those again are 2+ bilaterally. All right. I'm going to go ahead and do some reflexes as we continue. I'm going to have you rest your arm on your thigh. Good. I'm going to go 2 inches above the wrist and check your radial. Good. And I'm going to check your bicep. One more time. There we go. Good. And tricep. Good. All intact. Again, starting at the radial 2 inches above the wrist. Good. Bicep. Good. And tricep. Good. All intact bilaterally. I'm now going to go into some range of motion and strength exercises, okay? So with range of motion, I'd like to go ahead and have you follow what I do. So spread your arms or fingers. There you go. Good. Make a fist. We're going to check range of motion in your wrist, back, all the way around. Intact. Good. Flex and extend your elbows. Good. Intact. Now we're going to do shoulders. So I'm going to go all the way up, all the way down, behind your head, and a V, and then across. Good. Range of motion is intact. Now I'm going to do strength exercises. Have you squeeze my hands. Good. Grip strength is intact bilaterally. Equal strength. Now I'm going to have you make a fist. Have you pull towards me like a bicep curl. Good. And push away. Good. Elbows out. Good. And in. Good. And shrug against my shoulders. Good. All right. Strength is all intact. The shrug of the shoulders indicates that cranial nerve 11 is intact as well. I'm now going to go ahead and go into the head. So I'm going to palpate your scalp. As I palpate, I notice no deformity, no depressions, no obvious lumps or abnormalities. I also notice the hair is equally distributed and no abnormalities there. It's blonde and fine to the touch. I'm now going to go ahead, perfect, thank you for taking your glasses off. I'm going to have you close your eyes, and when I touch your face, I'm going to have you tell me what location of the face I'm touching. Okay?
Left forehead, right forehead, right cheek, left chin, right chin.
All right, and go ahead and keep your eyes closed for me. Does that feel equal on both sides?
Yeah.
No dull or sharp pains? Wonderful, so that indicates that cranial nerve 5 is intact. I'm now going to go ahead and have you pop out your cheeks. Good, and frown for me. Good, that indicates that cranial nerve 7 is intact. I'm now going to go ahead and palpate, okay? When I palpate your sinuses, I want to know if there's any discomfort or pain. All right? Any pain or discomfort?
No.
Good. I'm now going to go ahead and percuss your sinuses. Any pain?
No.
Any pain?
No.
Good. But now I'm going to palpate the exterior structures of your eyes, including your lacrimal glands, ensuring that there's no inflammation. Any pain?
No.
Good. Ocular bone is intact. No bony prominence noted. Now looking at your face, I notice that it is symmetrical. There's no obvious abnormalities as far as unilateral nasolabial fold, no unilateral facial droop, and as you smile, I notice that it is also equal. I'm now going to go into the structures of your eyes. I'm going to look at both the physical structures and then also do some light reflexes.
Okay.
Okay? I'm first going to look at the physical structures. I notice that your eyeballs are symmetrical on your face. No redness or drainage or crusting is noted. I note that their sclera is clear. The conjunctiva is white. There's no obvious signs of jaundice. Your iris is blue. Your pupils are equal and reactive to sunlight. We'll check the reactivity a little bit later as well. But they are dark and round and equal. We're now going to go into the light reflexes. As I do this, I'm using a pen light. I'm going to be checking your direct and consensual light reflexes. I'm going to shine a bright light. I would normally dim the lights for this exam, but dimming the lights would mean that you guys can't see me. So I'm now going to check the light. Look straight ahead at me. Good. Constriction of the pupils noted bilaterally. And now I'm going to check your consensual light reflex. So what I'm going to do is I'm going to shine the light in one eye and look and make sure that there's constriction in the pupil in the opposite. And I notice constriction, and I notice constriction. All right. And now I'm going to have you follow the pen light in 6 ocular fields, and that's going to test for a couple cranial layers as well. All right, you ready? All right, 6 ocular fields are intact. That means cranial layers 3, 4, and 6 are intact as well. I'm now going to look at your peripheral vision. And then actually, before I get rid of this, I'm going to look at your accommodation. So go ahead and follow the pen light all the way in. Convergence and accommodation is intact. I'm now going to look at your peripheral vision. I'm going to wiggle my fingers, and I would like for you to tell me when you can see them.
There.
Good.
There.
Good.
There.
Good. All right, so that's intact as well. I'm now going to listen to your temporal artery with the bell of my stethoscope. No bruit present. No bruit present. All right. Continuing down, I'm going to go into your nose. Okay, I'm going to palpate your nose. I do notice that it is midline and that there's no obvious abnormality there. Before I do that, I'm actually going to take my fundoscope and look at your eyeball. All right. Take my fundoscope. I am looking, and I notice your eye. Again, I would probably dim the light to make it easier for myself. I notice the retina, the red reflex, the vasculature, and the optic disc are all present. Again, retina, red reflex, vasculature, and optic disc are all present bilaterally. No obvious signs, again, of redness, discharge, or crusting in the eye. Now we're going to go back to the nose. All right, as I palpate your nose, let me know if you have any pain or discomfort. All right, no pain or discomfort, no bony prominence, no deformity noted. I'm going to look inside of your nose first, and then we're going to check the patency. All right, I notice inside there's no discharge, no yellowing, no redness. It is moist and pink. And I notice this bilaterally. Again, no redness, no yellow discharge, and no deviated septum. I'm now going to check the patency of your nose. So if you don't mind doing number 1, breathe in, good, and the other side. Good, patency, and that tests for cranial nerve number 1.
That's great.
And now we're going to go into the mouth, okay? Actually, we're gonna go to the ears. I'd like to do the ears first, if that's okay with you. We're gonna go ahead and put your hair behind your ears. As I look at your ears, I notice they're symmetrically sitting on your face. There's no obvious foreign body to the exterior structures. There's no scaling, no redness, and no drainage. I'm going to be doing a physical examination, then I'm going to be doing some hearing.
Okay.
First, we're going to do the physical examination. As I palpate the ear, is there any pain,
No.
discomfort? Good. As you're an adult patient, I'm going to pull the ear up and back. If you're a pediatric patient, I would pull it down and back. With the inspection, I notice there is no redness, no drainage, no obvious foreign body. There is a tympanic membrane that's gray pearl in color and concave in shape and obvious viscous earwax. We're going to be doing that to the same side, or the opposite side, sorry. Again, pulling up and back because of your adult age. And again, I see viscous earwax, no redness, no drainage, no foreign body. Tympanic membrane is present, concave in shape, and a gray pearl color. Alright, we're now going to go ahead and do some hearing examinations. The gross hearing is obviously intact because you've been responding appropriately throughout the exam. I'm going to now go ahead and do a whisper test. So what I'm going to do is I'm going to stand up behind you and to the side, and on that side I'd like for you to close that ear, and I'm going to whisper a word and I'd like you to repeat it for me.
8.
Good.
8.
Good. That actually tests for cranial nerve 8.
Huh? Hey!
And that means that it's intact. Now I'm going to do a Weber test that requires a tuning fork. What I'm going to do is I'm going to strike the tuning fork and put it in the center of your scalp at midline, and I'm going to ask if you hear it and feel it on both sides equally.
Okay. Yes.
Perfect. What I'm going to do is I'm going to do it on each ear.
Yes.
Hear it and feel it.
Yes.
Good. And they're both equal?
Yes.
Good. So now I'm going to have on each ear, whenever you don't hear the noise anymore, I want you to tell me.
Okay.
Go ahead and close your eyes for me.
Now.
Good.
Now.
Good. Alright, so that's intact as well. Now I'm going to go ahead and palpate your jaw and check for any TMJ.
Okay.
Okay, go ahead and clench your jaw for me and open wide. And no TMJ is present. Any pain with that?
Nope.
Alright, wonderful. I'm now going to go ahead and check your carotid artery, just so you don't forget. And that's a 2+. And 2+. Now I'm going to go ahead and listen to your carotid artery with the bell of my stethoscope. No bruit is present. And no bruit is present. Alright. Following that, we're going to go to the mouth finally. Again, as I noted earlier, it does look a little bit dry from the lips, but it probably just means that we need some chapstick. Mine are probably dry too. I'm now going to look and inspect the inside of your mouth. If you don't mind opening. So I noticed the buccal lining is pink and moist. No obvious dental trauma. All teeth are intact. I also noticed that your tongue is midline. That means that your cranial nerve 12 is intact. I'm going to again ask you to open. Hard palate is intact and gray with rugae present. Soft palate is again intact and it's pink. I notice no tonsils. I would grab a tongue depressor. I unfortunately don't have one. But I would ask you to put your tongue out and say ah.
Ah.
And uvula is present in midline, meaning that your cranial nerves 9 and 10 are both intact. I would ask you to stick your tongue out for me. Good. Cranial nerve 9 is intact. And wiggle side to side. Good. Excuse me. Now we're going to go ahead and look at your gums as well, so if you don't mind giving me a big smile. And no obvious signs of gum disease, no bleeding, and no discharge noted. I'm now going to go ahead and do a tongue strength test. So I'm going to ask you to put your tongue all the way to the other side of your mouth. Good. Push against me. Good. Good. Now you're going to do this with your chin as well, so push against the side. Good. Good. Strength is intact. We're now going to go ahead and continue down to the neck. Okay?
Okay.
With this, I'm going to palpate your trachea. Is there any pain or discomfort there?
No.
Good. And I noticed that you swallowed. Any pain with the swallowing?
No.
No. Good. While I palpated, I noticed that it was rigid but also malleable and, rigid but movable. No obvious deformity there. Again, it was midline. I'm now going to look at your neck. It does look symmetrical. No obvious rash or redness noted in the neck. I'm now going to go ahead and look at your lymph nodes. There's 10 that I'm going to be checking. I'm going to be palpating, and if you have any pain or discomfort, please let me know.
Okay.
Doing your preauricular, your postauricular, your occipital, your postcervical, your submandibular, your submental, tonsillar, your superficial cervical, your deep cervical, your supraclavicular. Any pain?
No.
Alright. Now we're going to go ahead and do range of motion for your neck, okay? So I'd like for you to put your chin to your chest, head all the way back and side to side. Any difficulty, pain, or stiffness?
No.
Good, good. And then ear to shoulder, shoulder, good. Alright. We're now going to go ahead and go into your chest.
Okay.
Alright. What I would like to do is have you stand up. If you have a hair, I'm going to have you put it to the front and turn around.
All right.
Alright. So as I noticed that she was changing positions, there was no distress or obvious work of breathing. She has been speaking in full sentences, so no obvious signs of respiratory distress. As she's sitting and breathing, I notice that there's no dyspnea, no use of accessory muscles. The skin is normal and warm and dry to touch. There's no rash or redness noted as well. I'm now going to have you breathe in deep. One more time. Equal chest rise and fall is noted. I'm now going to palpate. Any pain?
No.
Good. Either side?
Nope.
Okay. I'm going to percuss. I should be hearing timpani over all lung fields, in which I do. I'm now going to listen with the diaphragm of my stethoscope. And you're listening to 6 lung fields. Deep breath. Good. 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 I hear bronchiovesicular sounds in the top and vesicular sounds in the bottom, clear and equal bilaterally. I'm going to now check the lobes. 3 on the right. 2 on the left. Good. Any difficulty with that?
No.
Good. I also noticed that the cervical spine is midline, the thoracic spine is midline, and all the way down to the lumbar is midline. I'm going to now check for CVA tenderness. Knee tenderness?
No.
Alright, good. Since we're done with the back, I'm going to go ahead and have you turn towards me. Fantastic. And as we do the interior chest, I'm going to make sure to check for skin turgor. And again, that is rapid to return to normal, so I don't think that there's any signs of dehydration. I'm now going to go ahead and check your axillary nodes. If there's any pain or discomfort, let me know. Any pain?
Nope.
All right. Just for sanitation of the patient, I'm going to make sure to do some hand hygiene here as well. All right. I'm now going to make sure to inspect the chest. Again, there's no dyspnea, no work of breathing noted. I'm going to palpate 4 areas of your chest. If you have any pain, please let me know.
Okay.
Any pain?
No.
Any pain?
Nope.
Any pain?
No.
Good. I also noticed no lumps, no obvious abnormalities. I'm now going to go ahead and listen. Fantastic. All of those were clear and equal bilaterally. All right. Following that, I'm going to go ahead and have you lay down. As you lay down, I'm going to have you actually lay your head on this side so that I'm on the right side of you.
Okay.
Perfect. So as I'm on the right side of the patient, I'm going to visualize the precordial area. There's no obvious heaves or pulsations that I can see. I'm now going to palpate it with my palm, and I don't feel any heaves or pulsations either. All right, we're now going to go into the cardiac area. With that, I would like to assess your apical pulse, which is at actually your fifth intercostal space, mid-clavicular line, and I can palpate it. I'll palpate it for 15 seconds if it's regular and quadruple that, or I would palpate it for a minute if it's irregular. It is regular in about 62 beats a minute. No signs of arrhythmia. I'm also going to listen to your apical pulse with my stethoscope. Good. I'm now going to ensure that your cardiac sounds are all normal. So what I'm going to do is I'm going to listen with the diaphragm of my stethoscope to 5 different areas. Your aortic, your pulmonic, herbs, tricuspid, and mitral. I'm now going to do the same thing with the bell of my stethoscope. Again, aortic, pulmonic, herbs, tricuspid, and mitral. And S1 and S2 were heard. No obvious abnormalities or arrhythmias that I could hear, no murmurs. Also, I'd like to add that while I was listening to the lung fields, there was no crackles, no rhonchi, or wheezing noted. As we continue, I'm going to go down to the abdomen. I would like for you to lift your shirt up if you don't mind. All right. So as I inspect the abdomen, it looks equal, no bulging. The skin is normal, no rash, no redness, no obvious signs of trauma, no scars noted. And now I'm going to listen for this vasculature. So I'm going to listen to the aortic. This is going to be with the bell. No bruit present. The renal. No bruit present. The iliac. No bruit present. I'm also going to listen to the femoral. And no bruit is present either. All right. Going back to the abdomen. As I've already inspected, I would like to percuss. I should hear resonance and dullness over the spleen, which is ideal. I'm now going to palpate. I'm going to palpate with light palpation and deep palpation. Actually, before I palpate, I'm going to auscultate your 4 quadrants as well, just to make sure. Maybe auscultating with the diaphragm, all 4 quadrants. And all 4 quadrants have active bowel sounds. I'm now going to go ahead and palpate. Again, I'm going to do light palpation and deep palpation. If you have any pain, please let me know.
Okay.
Any pain?
No.
Any pain?
No.
Pain?
No.
Pain?
No.
All right, now deep palpation.
No. 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 No.
All right, great. I'm now going to go ahead and try and palpate your liver and your spleen. I'm going to do it with your liver first. It's going to be on the right side, so I'm going to put my left hand underneath your back. I'm going to have you take a deep breath in, and I'm going to palpate your liver. There's no signs of swelling, no enlarged liver that I can tell. Any pain with this?
Nope.
All right, and we're going to do the spleen. Again, I'm going to put my right hand underneath your back, have you take a deep breath in. Any pain?
Nope.
And I can palpate the spleen, and again, no signs of swelling or abnormalities. I'm now going to go ahead and check your femoral pulse. Should I feel it as a 2+ bilaterally? All right, I'm gonna put your shirt down for your privacy.
Oh, thank you.
You're welcome. I'm actually gonna have you stay laying flat for me.
Okay.
I'm now going to actually lift up your shirt. I'm gonna have you lift your head just a little bit, and I notice no bulging, no obvious herniation when she is flexing. Great. And now I'm gonna look at the legs as a whole. There's no obvious deformity, no differentiation in color. They are warm and dry to the touch. And the skin, again, is normal in color and no obvious rash or erythema. When I go down the leg, I am going to go ahead and palpate the dorsalis pedis, and they are present 2+ bilaterally. Again, my scale would be 0 to 4+. Tibial is intact, 2+ as well. I'm going to look at the nail beds. They are pink in color, and cap refill is again at 2 seconds. I'm going to go ahead and look at your range of motion. So I'm going to ask you to put your foot all the way up to the sky and down, all the way up to the sky and down. And I'm going to have you lift your knee and go against me. Good. Strength is intact. And flex. Good. Strength is intact. I'm going to ask you to put your foot down, put your foot all the way up, and now down with your pressing on the gas pedal. Same thing with the other foot. Good. And with this knee. And bend your knee. Good. And push up against me. Good. And down. Good. I'm going to have you pull your feet up against me. Nope, this way. There you go. Perfect. And now down like you're pressing on a gas pedal. Good. Strength is intact. I'm now going to have you put your leg to the side. Abduction and adduction of your hips. And same way. Good job. Way to make it work. And that is intact as well. All right. I'm going to go ahead and have you sit up. As we sit up, I'm going to have you sit down actually. I'm going to check your reflexes. As we're sitting down, I'm going to actually have you put your heel to your toe, all the way down your shin. Good. And I'm going to have you close your eyes with it and do that. Good. And do the opposite one too. Good. And that is intact. All right.
Just keep that.
All right. I'm going to have you cross your leg. We're going to do some reflexes here. I'm going to do your patellar.
Ooh.
Good. And then your tibia. Good. And then I'm going to have you put your foot up, and I'm going to do your Pinsky, and that is intact as well. All right. Patellar. Good. Tibial. One more time. Sorry. Still a student here. And then I'm going to look at your Babinski. Good. And again, intact. All right. Now I'm going to go ahead and have you stand up for me. While we're standing up, I'm going to assess your gait, and I'm going to do the Romberg's test. So with the Romberg's test, I'm going to have you stand forward. I'm going to put my hands beside you to ensure safety, have you close your eyes. I notice no swaying or altered gait, so that means the Romberg's test is negative. All right. I'm going to have you walk towards me. Good. And normal, steady gait. I'm now going to have you do heel to toe in front. Good. And then walk on your heels back. And then walk on your toes forward. Good, and no alteration in gait that I've noted. I'm gonna go ahead and have you sit down. I think that we are almost completed. I wanted to just assess and see if you have any tonsils. I don't know if I did that before. I wanna make sure that they're
gone.
They're gone.
They're gone. They've
Okay.
left my body.
All right, well I wanna assess that and make sure. Good, they are. I don't see them. If they were there, I would do a scale of 0 to 4+. I think that I am all finished. Do you have any questions?
No, thank you so much.
You're welcome. Again, it was a pleasure working with you. My name is Claire. I look forward to seeing you in the future.
Thank you.
All right.